And we're live. Assalamu alaikum everyone. Welcome to another session of the Y Live. आज का हमारा सेशन होगा जिसमें हम डिस्कस करेंगे ओमिक्रॉन. As we all know, Pakistan has detected its first case of the Omicron variant of the coronavirus. ये शुरू हुआ था Thursday को, where a 57-year-old woman who was unvaccinated, she was diagnosed, and after discharging the patient, she was isolating at her home and she did not have any travel history and the contact tracing was underway. Similarly, उनके साथ two other people were also diagnosed with it. So आज हम बात करेंगे ओमिक्रॉन के symptoms के बारे में, what can we expect, उसके हिसाब से vaccination efforts क्या होनी चाहिए. And so today we have Dr. Alina Zia. She is a second year infectious disease fellow at the Indiana University in the US. She has an interest in medical education and antibiotic stewardship. She is boarded in internal medicine and she completed her residency in Chicago. So without further ado, let's have her in. Assalamu alaikum, doctor. How are you?
Assalamualaikum. I'm good. How are you?
Yeah, I'm good. So again, Omicron, just heard of it. It's brand
Mhm.
new.
Yeah.
Pakistan, mein, I think it's only been like 3 to 4 days, and we're all panicking. For obvious
Yeah.
reasons, we've all returned to normalcy, and with it
Yeah.
just coming back again, it's
Yeah.
we don't know what to expect. So, doctor, starting with the term variant, since Omicron is a new variant,
Mhm.
हमें हम समझ क्या सकते हैं from the word variant? क्या सारे variant mutants होते हैं? And
Mhm.
do they keep getting more resistant? What's the
Mhm.
whole deal with it? Yeah.
Okay. Uska, I think such a example would be the flu.
Mhm.
Okay. The flu, as
Yeah.
you know, is also a virus. Okay. And so the reason कि आप हर साल नई flu vaccine लगवाते हैं because the flu changes every year a little bit. उसको हम
Yeah.
genetic shift या drift कहते हैं. हल्का फुल्का हो तो drift होती है, बहुत ज़्यादा हो तो it's called shift. So viruses are living things, um, and so to survive they change because uh, evolution का हिस्सा है कि आप just you have to change, right? For example, like we have opposable thumbs because we need them, um, and
Mm.
so and certain animals are cold-blooded because that's what they need to survive. Some animals are able to change their colors, some have like poison and all that. So um, just like that, viruses have to adapt to survive, because जब बहुत ज़्यादा एक्सपोज़र हो जाता है वायरस का एक कम्युनिटी में, देन यू हैव इम्यूनिटी टू इट बिकॉज़ इतने सारे लोग बीमार हो
Mm.
चुके होते हैं कि हर्ड इम्यूनिटी डेवलप हो जाती है. एंड सो the virus wants to survive. And so it's going to change how it looks like to be able to infect more people. Because so viruses are interesting things. Viruses cannot live outside of humans. So बहुत एक
Yeah.
scientific debate है कि क्या are viruses like living things or not? Because outside of a living entity, a virus is not considered alive. So so just for virus to survive, it needs a human host. So that's why they have all these changes to basically help propagate and continue to survive. And so viruses are constantly mutating and changing to survive, to make themselves survive longer, to spread all of that, and it happens all the time. That's why common cold की vaccine हमारे पास नहीं है, because there's so many viruses
Mm.
involved in that, they're constantly changing. We really can't. But most viruses that we know mutate and they change.
Yeah. So, is it natural to assume कि जब भी कोई नया variant आएगा, it will be worse than the previous one?
No, I think if the COVID pandemic has taught us anything at all, I think we need to first of all like wait, calm down, and just see what's happening. I
Mm.
think the scientific community made a lot of mistakes in the beginning, and as somebody who was part of the community when these things happened, we rushed to conclusions, we rushed to treatments, we rushed to like because we were grasping at
Mm.
data, कि जो हमारे पास information है, we're going to use that, and we made a lot of mistakes with that. We used a lot of junk data. Um, hydroxychloroquine was used for the longest time and had no benefit. In
Yeah.
fact, it caused problems. Azithromycin was used. Ivermectin, abhi tak, it's like still something that we're trying to like get people to stop
Yeah.
using it in the US, but like there's no reason for it to work, and it doesn't. But like किसी ने डेढ़ साल पहले कहा कि oh I used it once and somebody got better and like people just listen. So I think we just need to wait and see what happens. And ज़रूरी नहीं होता कि each variant is worse than the other, because so like I said, the virus has to change to survive. Um, so I'm आपको एक example दूंगी which we use quite a bit, which is the example of Ebola. So जब तकरीबन 5-6 साल पहले की बात थी, when we were very worried about Ebola spreading. But the problem with Ebola is it's so dangerous, it's so lethal कि it can't spread because इससे पहले कि किसी और को लगे, people die. And they're
Yeah.
so sick. They're so sick that it's really hard to like, because they're bleeding and they're very sick, and the people who get it are usually people जिनका ख्याल रख रहे होते हैं, like close household contacts, or the physicians or nurses who are taking care of them, not somebody that they met on the street. So Ebola is like the opposite kind of virus from COVID. It's hard to spread because it kills really fast. COVID is
Right.
so the thing that makes COVID so scary is a big proportion of people don't even know that they have it. So it can be harmless to very dangerous, and that's how it spreads because you don't know that you have it. But for a virus to propagate and to spread, there has to be a balance. It's जिसमें it is easy to spread, but it doesn't kill the host right away, right? उसका host मर जाएगा, तो the virus won't spread. So
Hmm.
there's that capability of the virus, and then the other thing is, um, the more a virus mutates, the easier it is to kill because um, yeah, again, this is a little more complicated in terms of like microbiology, but essentially जितना ज़्यादा एक virus mutate करता है, because it's using all that energy to 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 protect itself. Essentially, it becomes easier to kill. So the viruses have to find like the perfect like middle ground, just make it spread, but also not be so easy to kill. Um,
Yeah.
so it's really hard to say okay, what each variant will do. Um, but so
But
it
जरूरी
can
नहीं
really
है
vary.
कि वो इतना ही infectious हो जितने पुराने variants हैं, right?
Yeah, उससे ज़्यादा हो सकता है,
Yeah.
उससे कम हो सकता है. It all depends.
Yeah. So, based on the data, we still need more cases, right, to
Exactly.
predict कि कैसे होना है.
Exactly. We have some preliminary information from South Africa,
Hmm.
जहाँ ये detect हुआ था. But I mean, again, they're talking about 12 patients. It's really hard. Up
Hmm.
you cannot extrapolate something that happens to 12 people to the rest of the world. Especially, people are very different, and we made this mistake
Yeah.
before. So I really would encourage that people don't do that again. Like the prevalent idea is that yes, it may actually be easier to spread, but we haven't had anybody die of Omicron yet. So,
Hmm.
so there's a theory that maybe like it's easier to spread, so it's mutated that way, but and how it's gonna continue to spread is it's not gonna kill the host. Like, and so this is how viruses evolve. Um, and that's what the flu did, right? कि जब हमारी 1918 में flu pandemic हुई थी, the Spanish flu की, over a
Hmm.
million people died, but we still have the flu every year. It doesn't kill it doesn't kill as many people like it. I mean, there's still significant morbidity, mortality with the flu, but it's adapted to be able to spread, but not kill the host as fast. So that's what we expect that COVID is going to turn into.
Yeah. So, speaking about the diagnostic methods for detecting Omicron specifically, how do we know that a case is for Omicron? Like, how do we know that it's not some other variant and it is Omicron? So,
So,
are there specific testing kits that are made specific to Omicron or
so
to
no,
any other variant?
no, Omicron is it should so the virus DNA is the same. There's changes in the spike
Hmm.
proteins, which is how our body attaches to the virus and how we fight it or we
Hmm.
recognize it. But उसका जो inherent DNA है वो इतना बदल नहीं सकता, otherwise it'll turn to a different virus.
Yeah.
So the testing
Hmm.
that is used is going to be the same, but the way you detect mutations is ये arm kits में नहीं हो सकता. These are things that can only happen in the lab, like in a specific research or a scientific lab. Um, you can't get it done in some average
Mm.
lab, so you have to send it for like further testing, just they look at like mutations and all of that. So to figure out which mutation it is, that takes longer, and it's done in specialized labs. जिसमें इसका sequence run होता है
Hmm. So
virus का.
specialized labs तो ठीक कहते हैं if there is a patient who is detect who we suspect of having Omicron, क्या उसके लिए different kit हम use करेंगे कुछ या what will
No,
be different उसमें
no, it'll be the
या
same.
फिर
The
अगर
test,
rapid antigen करवाएंगे.
yeah, the
Hmm.
test will be the same because they can at this point, Omicron or Delta or Beta or whatever else, there really is
Hmm.
no for the patient right now it makes no difference. Okay, it's COVID or not COVID, so, and it really doesn't make any difference for us to change um, um, commercially produced kits for that. We just want to make sure we're detecting COVID, which all the Omicron variant is detected on regular testing. We don't need to find out कौन सा variant है. But figuring out what variant is more important to us as healthcare workers to figure out कि pandemic किस तरफ
Hmm.
जा रहा है और उसकी immunity के बारे में information जमा करनी है, treatments के बारे में जमा करनी है, but it doesn't really make a big difference to the patient. So that's not something that people should really have to worry about or think about.
जी अब हम बात करते हैं the disease that Omicron naturally causes. So अभी तक का जो डेटा है या अभी तक जो देखा गया है जिन कंट्रीज में Omicron rapidly spread कर रहा है, साउथ अफ्रीका, some parts in the UK, यूएस में भी कुछ केसेस हैं, पाकिस्तान में भी रिसेंटली आया है. तो is the severity more or is the severity less or do we know?
So again, I will caution against making any conclusions. We've only heard about it about 2 weeks ago, ठीक है? और मतलब
Hmm.
COVID doesn't move super fast. A lot of times लोग कुछ दिन के लिए ठीक होते हैं, उसके बाद उनकी तबीयत खराब होना शुरू हो जाती है. So it's still
Hmm.
too early to tell. From my understanding, no one has died of Omicron yet. But again, it's too early to say. So our hope and our theory right now is that it's less deadly,
Hmm.
but again, we don't know that for sure at this point.
Oh, okay. So, can Omicron overcome immunity from vaccines or from previous infections through COVID? या फिर उसके लिए भी where do we need to give a booster to prevent
Yes,
against
yes, that's that's
the
actually a very good question, and that is something that is concerning us. So a lot of the vaccine companies are working
hmm,
on boosters specifically designed for Omicron,
hmm,
because there is a concern that it will render previous immunity less effective.
hmm,
Of South Africa, there was a study that looked down again. It only looked at 12 patients, so I would caution you to like believe that. But however, they found the
hmm,
immunity to Omicron variant for 12 patients serum general test kiya was only 23% out of those 12 people. So the level of immunity was significantly decreased. However, we still feel that the vaccines can protect against severe disease. So you can probably still get it, but um, जितना आप बीमार हो सकते हैं आप उतना बीमार नहीं होंगे. So that's our hope. But yes, Pfizer's put out this data that they feel give उनकी जो दो um, injections की जो series is probably not going to be enough for Omicron, but they've shown based on their early data that the booster is going to help neutralize the virus. So I would recommend, first of all, people who are not vaccinated, please, what are you waiting for? Get vaccinated.
hmm,
And then the people who are vaccinated and it's been about 6 months, they should definitely get a booster, because ये बात तो हमें पहले से पता थी कि COVID immunity wanes, and realistically, and within the scientific community, we've talked about this amongst ourselves for a long time. We don't think COVID's going anywhere. We think it's going to be one of those things जिसमें आपको yearly boosters लगवाने पड़ेंगे. It's something we will have to learn to live with. It's obvious it is hopefully going to get a lot less lethal, but it is not something that's going to leave us.
yeah. So, speaking about the severity of the disease, आपने कहा कि there are only 12 cases right now, so the data that can be the analysis that we can get is very limited. So उसका infectivity rate के बारे में हम अभी कुछ कह सकते हैं or is it still too soon?
I think it's still too soon, to be honest.
Hmm.
We'll really have to look at the data, and I know that can be frustrating, but I think we've learned from our mistakes previously, in which we've like jumped on the bandwagon. It got like मुझे याद है Japan से एक variant था. I think it was the I'm not even sure. It was like the Omega or something. I'm not even sure. Like Greek alphabet, मुझे मतलब याद करना पड़ा है. But and it was really concerning because apparently it was immune to all the vaccines. But
Hmm.
a variant that's so mutated cannot survive, so it didn't spread. So again, and when we heard about it, we were very worried about that variant, but it didn't spread. So again, it's really hard to tell right now. All we can do is ehtiyat kare, get vaccinated. If you have comorbids and significant associated conditions, be careful. um, try not to be around crowds, and do not interact with unvaccinated people. Just be careful, like you yeah like you would.
Yeah.
The pandemic is not over, and that's the only thing that this variant is reminding us. The pandemic is very much going on. एहतियात जरूरी है.
Great. So, काफी कुछ data आया था. It says that the doubling time for the variant is 2.5 days. तो क्या ये बताता है कि infectivity ज़्यादा है, कम है, or what is it?
I mean, again, these are this is just basically so doubling time basically um, is more important about uska, how long it takes to spread, how long its window period क्या होता है जिसमें आपको you get infected but you don't have symptoms and you're not
Hmm.
infectious. So that again, it doesn't tell us much yet. Again, these are things that um it's hard to tell what this means. It may be faster or slower than the other variants, but again, we just don't have the information to really make any solid statements about that.
Yeah. So, currently अभी COVID-19 की treatment चल क्या रही है according to recent like guidelines, and will
Yeah.
these treatment work? Yeah, are they working against Omicron? And how are these any different from other COVID cases?
So we do not have Omicron specific treatments because again
Hmm.
the virus was discovered 2 weeks ago, uh, and we haven't had an influx of Omicron yet. Delta in the
Hmm.
US, Delta is still is the dominant variant, and I believe Delta is the dominant variant in the world still. So nothing really has changed. Treatments हमारे वही हैं, steroids for patients who have hypoxia, um, antibodies and immunologic therapy for patients who are sicker, and then MAB treatment for people who are exposed. So you want to prevent them from getting sick. There's data coming out that fluvoxamine, which is an antidepressant, may have some benefit to preventing people from getting admitted. So there's that information coming out. Remdesivir is falling out of favor a little bit because it really hasn't shown a lot of benefit. It may help, it may not. The data we have, the strongest data we have that supports it, says that आपकी hospitalization length of stay कम होती है. That doesn't, again, they didn't look at steroids versus
Wait, so is
remdesivir. They
that
just
a
looked at
monoclonal
remdesivir.
antibody that we're
I'm
speaking
sorry.
about right now?
I'm
Is that
sorry.
a monoclonal antibody that we're speaking
Remdesivir,
about
no.
right now?
Remdesivir is an antiviral.
Yeah. No, the drug that you mentioned before that.
Hmm. Yeah, the monoclonal antibodies are the MAP treatments. There are multiple
Yeah.
different brands that are available, Regeneron, Regencov, and all the others. Those are basically the idea for them is to be given in the outpatient setting for high risk patients to prevent them from getting admitted. Um, and then, like I said, fluvoxamine is an antidepressant that's being looked at. And then we're trying to get this. Moderna has one, and I believe AstraZeneca also has a pill, which is an antiviral directed at COVID to prevent worsening. Um, we're still waiting for it to get final approval here. The data looks promising. However, we still, we're still waiting to see what happens with that. Apparently, one of the oral antivirals reduces morbidity and mortality by 37%. But again, it's data, derived data. The company that produces the medication, unka data is something else, and real world data is something else. So we have to wait and see what the FDA decides on that.
Yeah. So, what are the contraindications for corticosteroids more specifically? Because I've heard that you should really wait before you administer corticosteroids, even if it's in COVID. So,
Honestly, no,
yeah,
I think steroids are the only treatment that we have that are for sure have been proven beneficial to have a mortality benefit. I think any patient who's requiring
yeah,
oxygen, हर एक के लिए नहीं, it's not going to help. Like, there's no reason to give it if you have COVID आपको बस नज़ला जुकाम है. But if you are requiring oxygen and you're feeling sick, then there's definitely a role of giving
yeah.
steroids. Contraindications would be, it's very specific. If you have,
इम्यूनोसप्रेशन भी करवा रहे हैं ना वो
I'm
इम्यूनोसप्रेशन
sorry.
भी करवा रहे हैं सो इम्यूनोसप्रेशन करवाते हैं ना
Yes,
corticosteroids.
yes.
Hmm.
And the problem with COVID is it activates the immune system, and so much that
Hmm.
it starts destroying our own body. So it's not just like the virus;
Hmm.
it's just like the immune system gets super activated and starts destroying things. So yeah, steroids are immune suppressants. So I mean, the most common contraindication would be somebody if they're allergic to steroids, which would be unusual, but it can happen because steroids are actually used for allergies.
Hmm.
B, if they have if they're in diabetic ketoacidosis, because इसमें sugar levels बहुत high जाते हैं, steroids to increase your sugar levels. So they can be specific reasons for not using steroids, but those are very rare. Typically, most patients can get steroids, because even patients, I know the big concern is कि if you're septic, आपको कोई bacterial infection है, you can't
Yeah.
give steroids. But septic shock के treatment में steroids are used commonly. Pneumonia के treatment में steroids are used commonly. You can modulate the risk by giving people antibiotics, but I still feel that, and not just me, I mean the scientific community feels that steroids are most important weapon against COVID,
Yeah, and especially I
apart
guess
from vaccines.
steroid resistance, especially is on the rise. So I think even in COVID, we don't really prescribe antibiotics, right? Even
No.
if it's yeah, yeah. So what are the symptoms that we're expecting? Since that's the whole topic for today. So what are the symptoms that one can expect for Omicron? Is it the same symptom phase or flu type?
I don't. I don't expect the symptoms of Omicron to
Hmm.
be any different from traditional COVID.
Hmm.
Um, so and the symptoms are pretty varied. Some people can have flu-like symptoms, some people can have GI symptoms, some people are completely asymptomatic, and some people get really sick, have respiratory failure, cardiac failure, have neurological symptoms, strokes, blood clots. So it really can vary. I don't anticipate that Omicron is going to be different. Um, I think it's probably going to have the same presentation, maybe milder, maybe more severe. We don't know, but I think it's going to be pretty similar.
Yeah. And speaking about vaccines, a lot of people are hesitant on getting booster shots. For example, when I got my booster shot of Pfizer, so I did experience some symptoms, my chills, hey, generalized body ache,
Yeah,
and that lasted for at least a day and a half. So,
yeah.
what exactly, like my first, the मेरे पहले जो 2 doses थे, that was Sinopharm. So,
Hmm.
why do you think Pfizer का मेरा ऐसा हुआ, although I had been vaccinated previously, but just not from Pfizer. And do you think it's normal for people to explain have these side effects? Because a lot of people काफी बार घबरा जाते हैं और मुझे दूसरों को बताते हैं कि ये symptoms हुए बूस्टर से, so लोग नहीं लगवा रहे हैं. So what would you say about that?
So mRNA vaccines are, our latest and greatest weapons against COVID.
Yeah.
They activate the immune system more than traditional vaccines do, which is why they
Hmm.
work so well against COVID. And so it's pretty common to have adverse effects. I had them. I've gotten Pfizer 3 times now. It was not
Hmm.
pleasant, but COVID is much more unpleasant than having these like adverse effects of headaches, fevers, or pain. So basically, it's mRNA vaccines just activate your immune system because they make the body think that the body is being attacked, but in a controlled way.
Hmm.
The mRNA itself disintegrates within a few hours, but it so this is a little technical, but but basically the way that we make proteins in our body is mRNA is a messenger. The mRNA tells you, okay,
Hmm.
this is how you have to make a protein. So the mRNA encodes for the protein for the spike protein for the virus, for the COVID virus. So the body senses this as an alien thing, but it's not a piece of the virus. It's only the mRNA that encodes for it. And so our body reads that and says, okay, we need to produce proteins and antibodies against this invader that's come in. And so it activates the immune system and creates antibodies, which, and it's a pretty robust response. And actually having adverse effects to the vaccine is good, as long as you're not having anaphylaxis or something very severe, because that means your
Hmm.
immune system is working. So yes, it can be
Could you
unpleasant.
explain what an anaphylaxis reaction is, ताकि अगर जो जनरल पॉपुलेशन है अगर एक्चुअली एक्सपीरियंस कर रहे हो तब वो हॉस्पिटल की तरफ जाएं, तो आप जरा बता सकती हैं आसान लफ्जों में एनाफिलैक्सिस रिएक्शन में
Yeah.
क्या होता है?
So anaphylaxis is a severe reaction to any medication, or medication, peanuts, bee stings, anything. It's a severe allergic reaction. Just may basically your face starts to swell up and your throat closes up, and because of being exposed to something that causes the allergy, you have start having trouble breathing, and you get swollen up everywhere. So that's a severe and life-threatening allergic reaction. Um, so that is obviously something of concern. If that's what happens to somebody when they get vaccinated, and they should be careful. But that's pretty rare. What are acceptable side effects are, fever, chills, having pain at the site, being feeling tired, having flu-like symptoms. That's all normal, and it should pass in a day or two. And it's totally okay to take Panadol, paracetamol, Brufen to get through it.
जी, so डॉक्टर मैं आपसे आखिरी सवाल यही होगा कि how concerned should we be about Omicron? Or yeah, that's just it. Because like everything's getting slowly back to normal, and then we're stuck with Omicron now. So आप बताएं, how careful should we be? How concerned should we be?
Final words, the pandemic is not over. We should be vigilant still. We should be careful still. We should get vaccinated. We
Hmm.
should convince our family members and friends who are not vaccinated to become vaccinated. We should avoid big gatherings. And Omicron is just one variant. The virus is going to keep on mutating. There will be more variants. That is a guarantee. It is going to happen. So we have to be sensible in how we deal with this. Um, we have to listen to the experts. We have to be careful, and we have to exercise common sense. Ehtiyat kare, be careful around people. Be careful around big groups. Live your life, but don't be reckless. And
And
again, the
get
pandemic is
vaccinated.
not over, and don't
Get
and just,
vaccinated.
yeah, get vaccinated. Don't be scared all the time, but don't be a cowboy. It's still going on.
Yeah. Thank you so much, Dr. Alina. This was a really brief session on Omicron. I hope our viewers got to know more, got to learn more, and it was really nice having you. We kept it really short this time. Hopefully, next time we can have a more in-depth discussion. And thank you so much for joining us and taking our time.
Thank you for having me.
Okay, thank you, everyone. Allah Hafiz.